a rhythmic stream. Woo! They said, give us anything and we'll make music. So who knew you could make music with a trash can? Or deliver products with a drone? I promise we'll not hit anybody in the head. No accidents. Okay, so this is obviously a bit about the future, a bit about what I'm seeing as I move around in your communities, and the most important thing is what I've heard from you as I've talked to you not only here at this conference, but over the past weeks and months. So one of the things we all read about is that 2016, your Amazon purchases could be dropped at your door within 30 minutes, courtesy of an unmanned aerial drone like the one we just saw. It is an amazing new era, certainly for people like me. And Amazon CEO Jeff Bezos doesn't let fear of failure or even ridicule stop him. He said, if you never want to be criticized, for goodness sake, don't do anything new. Right? That characteristic of fearlessness is a characteristic of the most successful CEOs, according to Adam Bryant, a New York Times columnist who has been with us at our 2 previous conferences. He writes a column every Sunday in the New York Times about a successful CEO. And when he looked at the most successful, he said this fearlessness, which means it's a bias toward action and a willingness to take risks. Sound like anybody out there you know? Well, I'm very proud to be here today with so many fearless leaders. To see you, yesterday some of you were here, to see you registering this morning, to see so many friends, so people I've come to admire and adore, is just a very special treat for me. And I hope for all of you, as you get to reconnect with people maybe you haven't seen since the last conference. And today, certainly, we are welcoming you to a conference that is bigger and better every year. Your conference actually is becoming healthcare's behavioral health conference, and that's quite an accomplishment. I don't think any of us would have ever thought 20 or even 15 or 10 years ago that behavioral health would be center stage in healthcare discussions. But there's one person, before I go on, that I really need to thank, who puts this together with military precision, along with loving care and kindness, and that's our Executive Vice President and Chief Operating Officer, Jeannie Campbell. Woo! Where is she? She is amazing. So today, we have a drone taping the National Council Conference. But it wasn't so long ago when at least I was programming or trying to learn how to program my VCR. Or we were renting videos. Remember Blockbuster? I spent many a Friday nights with my kids picking out videos for the weekend. And how many of you remember taping songs off the radio? And how about classified ads or the penny saver? Well, today we know Craigslist reinvented the way we sell things, Pandora and iTunes reinvented the way we access music, and Netflix certainly reinvented the way we watch TV. Actually, next Friday night, when this is all over, I'm going to go home, connect to Netflix, and binge on House of Cards Season 3. Yeah! I can't wait. Reinvention is about looking at things differently. How many of you ever use Kodak film? Look familiar? They don't even sell it, by the way, in the gift shops. Kodak's slogan was, "You press the button, we do the work." In 1976, Kodak accounted for 90% of film sales in America. But digital photography sent them into a tailspin. They declared bankruptcy a few years ago and are still struggling to reinvent themselves. Their competitor, Fuji, had a very different story. Facing the same disruption, Fuji looked at what they did from a different perspective. They turned their technologies into new products. They developed components for the LCD flat screens we all have to have now in our houses, high-resolution endoscopes, digital X-ray machines, and they actually came out with a line of cosmetics using the chemical that promotes elasticity in the film, and I put it on my Amazon Prime wish list. In 2000, film made up 60% of Fuji's profits. Just 12 years later, it's not a factor at all in their bottom line, and the company is thriving. It's impressive considering the world told them their product was extinct. Like Fuji, we need to be clear-eyed in our assessment of the environment and the opportunities we all have for reinvention. Take Dale Klatzker, President and CEO of the Providence Center in Rhode Island, a former chair of the National Council, I'm proud to say. Dale led an effort to reinvent his organization and join forces with Care New England, a major hospital system. Scary? Probably. Smart? He hoped so. Fearless? Certainly. He said consolidation and community-based care are not incompatible with getting care locally. He said care can and should be delivered near where we live, but patients also deserve a full continuum of services to be available under one auspice. Tim Swinford saw reinvention from a different perspective. Whoa, Tim, Missouri is here. CEO of Pathways, a Missouri behavioral health organization, Tim led a merger with Crider Health Center and FQHC. It actually began with a conversation in a National Council conference, if I understand the story correctly. He and the CEO of Crider, Susan Hebner, had a conversation after going to a workshop on mergers. The result, a few years later, is Compass Health Network, with the resources to care for over 100,000 adults, children, and teens. Tim said it's time for us to transcend the status quo if we are to remain viable. And the National Council is not a stranger to reinvention, to challenging our status quo. We've grown our staff, we restructured our teams, we've doubled down on policy and technical assistance. But most significantly, we completed a merger with the State Association of Addiction Services. I agree. A phenomenal accomplishment, really, with the leadership of our board and the board of SAS. So now we have a great vice president of addictions, Becky Vaughn, and we have a new, yes, and we have a new high caliber addictions committee, many of whom are here, and addictions is becoming front and center at the National Council. We need to look at what we've always done, square in the eye, and decide it's time to do things differently. Those around us are certainly doing that. Managed care organizations, hospitals, and FQHCs are interested in our customers. Independent practice groups are interested in our customers. And hard to believe, private equity and venture capitalists are interested in our customers. It's the result of getting what we wanted, full inclusion in healthcare. Thanks to the ACA, 9.3 million more people have health insurance today. The uninsured rate has dropped from 20% to 11.8% and continues to go down. But the ACA isn't only about the numbers of people with insurance. It's about models that integrate care and designate responsibility and risk for the health of a population, something many of you are not only talking about, but are taking a step and getting very involved in your communities, because you know the customer wants it. Do you really want to run all over town to buy dish towels, bananas, and toilet paper? We want one-stop shopping. We want convenience. We want to deal with a company that we know and trust. And that goes for our health care as well as our groceries. Walmart is shaking up the market. Now you can get a health care checkup, buy a newspaper, bananas, and toilet paper all in one place. Did you ever think we'd be in competition with Walmart? It's a strange new world. Colleagues of the late guru Peter Drucker, the great management thinker, they wrote just recently, yesterday's customers needed to go to a store for help. Yesterday, customers needed to do it at the time the company said, 9 to 5. Today, customers expect to be helped at the time they want to be helped and on their terms. Companies who get this are revolutionizing their industries by focusing on customer convenience. It's a powerful lesson, and it's not lost on National Council members. Raul Rusi grew Acacia from a small drug abuse program to a Latino-based health, housing, and economic development powerhouse. Their success is all about world-class customer service that says, we are here for you. We will make it easy for you to get what you need in a way that works for you. More and more, what works for us is something I even brought on stage with me, and I know that each of you has it, and when you get tired of listening to me, you'll be doing your email or maybe even texting, and that is our smartphones. How many of you text appointment reminders to the people you serve? How many of you get texts from your dentist reminding you of your appointments? Big difference, right? Are you using apps as staff extenders, tracking activity or managing symptoms, using smartphones as a gateway to engagement? If you have teenagers, and I know there are many of you in the audience who do, you wouldn't be surprised to learn that the average adolescent sends 2,000 text messages a month. 2,000. In New York City, the crisis text line receives 15,000 texts a day from young people looking for help. And it's a game changer, both because texting is how they're really connecting with each other and getting people help, but also because of how they're analyzing the data. They know that substance abuse is likely to peak at 5 a.m. across the country. And suicidal thoughts are least likely in New Hampshire. These data are becoming to us in behavioral health what customer data are to Walmart and Amazon. They tell us what our customers want and need, and they're going to reshape our industry. A Kodak photo is 20th century. A drone is 21st century. Mike Schwen, CEO of Preferred Family Healthcare in Kirksville, Missouri, understands this. They use a 3D virtual environment complete with avatars to provide substance use treatment to adolescents post-residential care. Pretty impressive, right? It's no surprise that tomorrow night they'll receive the Award for Excellence in Addiction Treatment. Yay! Technology platforms like MyStrength, Big White Wall, Health Buddy, and smartphone applications like Ginger.io are not just cool tools, And they're all here, by the way, for you to look at and learn about. What they really are is reinventions of our industry. But we have a problem, and we know it. We know that payment follows innovation. It doesn't come before innovation. And that makes technology investments difficult, and they present risk. I had a recent conversation with a West Coast member that I know fairly well, and she considers investments in technology a must. She knows how important it is and that we are going to be using it in an array of different ways in the coming years. But she said that those investments are financially impossible for her $7 million agency. And that limitation is a calculation in her and her board's decision to pursue a merger with a larger, better resourced organization. I never would have believed that a $7 million agency wasn't viable in the future. And it is viable, but it is difficult. Difficult to do the things that are being demanded of all of us. But fearlessness is not limited to mergers or the adoption of technology. Fearless people start conversations even if those conversations are uncomfortable. Is Alcoholics Anonymous irrational? Shouldn't the conversation about reducing suicide include restricting the most efficient means, guns? Do we really need another anti-stigma program? Wouldn't reimbursements that give staff a living wage be more effective than a workforce summit? And if addictions are chronic conditions, why isn't care coordination, housing, and a full array of medications available in every community? Why is it so difficult for families to find help for the people they love? Is it time to bring back the asylums? A few of these have provoked some fascinating conversations, especially the last one, courtesy of tomorrow's plenary speaker, Dr. Ezekiel Emanuel. Provoking conversations that are controversial is a gift. It really is a gift to us by healthcare rebels like Dr. Emanuel. The late Steve Jobs has a great quote about rebels. You can quote them, disagree with them, glorify them or vilify them, but the only thing you can't do is ignore them because they change things. Yes, I agree. Dr. Emanuel has sparked some very needed conversations. Asylum is a lovely word for institution, but institutions aren't lovely at all. I worked in a state hospital, as I'm sure a number, if not many of you have in the past, an experience that both horrified me and educated me. So I've seen the abuse of power that's created when one group of people are in charge of another for long periods of time. So we said no more. And many of you and your predecessors were involved in building services so that now we have hundreds of thousands of people living successfully in our communities. But we still face problems, and we all acknowledge that. People in jails and prisons and nursing homes, tragic alternatives to insufficient community services and housing. Francis Greenberger understands this. When his son was convinced he was being followed by a drug dealer, the police ignored him. His son then lit a fire in his apartment, thinking the firemen would save him, but he was arrested for arson. This young man, not yet out of his teens, spent 2 years in Rikers Island before being transferred to an upstate prison for the remainder of his 5-year sentence. Greenberger says and speaks on behalf of many families, We must find better answers. The status quo serves no one's interests and makes us all less safe. We know people recover. And we expect people to recover. But not everyone recovers on the timetable we or they might like. Families are left wondering how to care for their loved ones. They're angry, they're afraid, and they feel very alone. And they deserve better. The outcome of Francis Greenberger's story might have been different if he and his son were connected to a program like Westchester MHA's One Track. One Track is for adolescents and young adults experiencing a first break. A package of services, mental health, substance use, medication, recovery coaching, education, is all wrapped around the young person and their family. MHA CEO Amy Cohn knows that by identifying, and intervening early, it's possible to mitigate lifelong disability and certainly avoid the tragedy of Francis Greenberger's son. Members around the country, including you in this audience, are reinventing their services based on new findings. The rates for 9 of the 10 leading causes of death are down, but not for suicide. Instead, the rate continues to rise. Wednesday's TED Talk, Ebola versus Suicide, was prompted by a discussion about the dangers of suicide contagion. The desire to die by suicide isn't catching. It's a response to intolerable emotional pain. The Lufthansa crash is all over the news. But far closer to home, 2 DC colleagues took their lives last month. Both were skilled and highly regarded men, and both left families behind. Now, we can't know if we could have saved Andy or Kevin, but we do know that if we implement the roadmap developed by the National Action Alliance for Suicide Prevention, we will reduce suicides by 20% in the next 5 years and by 40% in the next 10. We still hear from practitioners who say that their patients completed suicide and they were determined to do so. It was inevitable. That is not true. Changes in practice will save lives. The Coleman Center in Ohio and the Institute for Urban Family Health are doing just that. They have joined the Zero Suicide movement, and I urge us all to do the same. Fearless people wonder why things work the way they do, and they think about ways to make those things better. And that most certainly describes a very important group of people in this audience, the National Council Board of Directors. Exceptional leaders from across the country, and I'm going to ask them to stand so we can say thank you. I know they're here. One of the greatest gifts you all have given me and the rest of the staff is we are in the midst of an election right now. We have elections every spring because terms are staggered. And this election has people running against each other in many, many of the regions, fiercely fighting it out. Now, that doesn't always feel like a great thing, but I think what it represents is your commitment to working together, to make and find solutions to very difficult problems. And this is a thank you from me to all of you that are running and have considered running. We are very, very grateful. You will join a board that has a vision of a nation of healthy and safe communities, with the National Council working to make that vision a reality. An organization starting with me and extending to each of our talented and creative staff that will be there when you need us. At the conference, that means anyone wearing a blue scarf or a blue tie will either answer your question or they will walk you over to someone who can. The National Council is an organization that gets what people in trouble want. A mother that thinks her son needs residential drug treatment doesn't want a link to a website. She wants you to connect her to care. A distraught young veteran, overwhelmed and scared, doesn't want to be seen in 3 weeks. His gratitude is endless when you say, "Come in today." When someone is struggling, help should be as close as the nearest citizen. That's what mental health first aid is all about. And I am proud to announce today that we have trained 400,000 Americans in mental health first aid. That is your project. You gave us the support to bring it here to the USA, and we are all together making a difference. To quote Pam Hyde, who'll be here Wednesday doing a town hall, mental health first aid has become the Coca-Cola of health education. I think she means it as a compliment, yes? I hope. Working with our very important partners, the states of Maryland and the great state of Missouri, our goal is to train 3 million Americans by the end of 2020. Last month, we moved one person closer when the National Council staff trained First Lady Michelle Obama. Amazing, amazing, amazing. That was really the work of Betsy Schwartz, our vice president, who had worked tirelessly with the White House to make that happen. They fell in love with mental health first aid, and they told the First Lady she would as well. So now she's let the world know she's a believer. Mrs. Obama said, "I saw how useful mental health first aid is. It really gives you the skills you need to identify and ultimately help someone in need." Michelle Obama is convinced. But communities need resources if 3 million Americans are going to be trained. And that means convincing Congress. The National Council's policy work has become legend, and Chuck Ngolia is legendary for what he accomplishes on the Hill. Last night at one of the receptions, someone came up to me and said, "Oh, I love the National Council, you're fabulous, but I have to tell you, I'm a Chuck woman." He gets more done by midday than Congress gets done by midterm. True, it's true. At the urging of National Council members, all of you in the audience, Congress appropriated $15 million to local communities for mental health first aid. And last month, the Mental Health First Aid Act was reintroduced in the Senate, and just a few days ago, maybe last week, it was reintroduced in the House to great bipartisan support. But mental health first aid is only a piece of our pie. National Council members spent years educating Congress on the lack of parity in the safety net. And a year ago, the Excellence in Mental Health Act was passed. The largest federal investment in mental health and addictions in well over a generation. A huge accomplishment that, again, all of you did. All of those Hill days, all of those alerts and letters and emails make a huge difference. I now urge you to encourage your states to apply for a planning grant. No cost, they'll get some money, and you will be among the first certified clinics accessing $1 billion in prospective payments and at the forefront of standardizing care and improving outcomes. But our work is far from over. We must continue to play offense. We must help Senators Stabenow and Blunt make good on their commitment to take the Excellence Act from 8 states to every state. We must pass the Comprehensive Addiction and Recovery Act and the Behavioral Health IT Act. We must ensure that parity is implemented as we intended. And we must amend the IMD. But we also need a strong defensive game. Sequestration is looming. We're preparing for an expected attack on Medicaid, and we need to protect the block grants from the chopping block. So what can we do to move an assertive policy agenda, to deliver quality services when and where needed, to not only survive, but to thrive? We can start by wondering why things work the way they do and whether they can be improved. We need to explore new partnerships that lead to new possibilities. We can have uncomfortable conversations that challenge our beliefs and offer new perspectives. We can embrace new practices and new technologies. We can make our voices heard. We can come together in DC October 4th, 5th, and 6th for the Unite to Face Addiction March on Washington and National Council's Hill Day. It is all up to us. Sheryl Sandberg, the author of Lean In, said the best career advice she ever got was from former Google CEO Eric Schmidt. He told her, if you're offered a seat on a rocket ship, get on. Don't ask which seat. You know what I say to that? The National Council has a seat for every one of you. Be fearless, climb aboard. Thank you. Thank you.